I'm sitting here with Oran Kivity from Taiwan. He's in the city of Kaohsiung in southern Taiwan, and he's teaching the Manaka Style Acupuncture at Chiway, and just recently published a book on that Manaka Style Acupuncture. Can you briefly introduce yourself and tell us a little bit how you came to Manaka Style Acupuncture?
Yes, hi. Well, hi everyone, and thanks for watching. And yes, as Simon said, I'm in Kaohsiung in Taiwan, so it's winter, but winter not as you know it in Europe. So I'm an acupuncturist, British acupuncturist living in Taiwan, and I originally studied TCM. And I moved from TCM when I met Stephen Birch, who I would call my mentor and teacher, and I retrained into Japanese acupuncture methods. And the first Japanese acupuncture method I encountered was Manaka Style Acupuncture. So basically, I've gone from TCM to Japanese acupuncture, and then I learned Toyohari and meridian therapy. And then I discovered Ontake, which is a moxibustion method, and I've kind of made my name to some degree in teaching Japanese moxibustion. So that's who I am.
You said you first did Japanese acupuncture, then Moxa, and then came to Manaka style. For people who are not familiar with the Manaka style method, what makes this approach to acupuncture different from other Japanese style acupuncture?
I think I should say a few words about Dr. Manaka, really, to say who he was, and then that will explain a little bit more about his system. So Dr. Manaka was a medical doctor primarily, and he had a fascination for traditional methods of healing. And he brought a research focus to acupuncture, essentially. So he wanted to research some of the assumptions that we have in Japanese acupuncture. And then he came up with a very a, a systematized way of dealing with acupuncture and of treating patients. It's something that we call Manaka's four-step protocol. And I'll talk about that in a little more detail. But essentially, Manaka came up with a system using the 8 extras. He used the 8 extras in a structural way. So he saw them as forming an octahedron in the body. And you can ask me a bit more about that if you like, and I'll explain a bit more. And this octahedron was balanced by the 8 extras. So he used the master and couple points to balance this structure that he saw in the body. And then after that, so that was his first 2 steps of his protocol, was balancing the yin aspect of the body, the front, and then the yang aspect of the body, the back. And then he said, look, if people have got really obvious structural anomalies, like one leg is longer than the other, or there's, muscular development on one side of the back, but not the other, then you can do some adjustments. So he had some physical adjustments that you could do at step 3, but he didn't do them with everyone. And then step 4 was treating symptoms. So then he said, you have to treat root first, structure then, and then symptoms next. So that was his 4-step protocol. So it's like a series of coat pegs, and then you just put these techniques onto each step.
I've seen you describe this method as like deceptively simple. I find it quite maybe confusing coming from a more TCM approach, not familiar with Japanese acupuncture. Why do you say it's deceptively simple?
I think that we all experienced this when we first went to acupuncture school. We had to learn terms like yin and yang and qi and blood, and they had very specific meanings, deficiency, excess. So we had to learn a new vocabulary in order to understand acupuncture, meridians, channels, sinew channels. And it's the same with learning Manaka. You have to learn and expand your thinking a little bit to think in terms of this structural model that he was talking about. And once you get hold of that structural model, then it becomes more simple. And it becomes like a very simple thing to do. I'm going to do step one. Oh, now I know what to do. I'll do step two because I know what my step one was, and then step three and step four. So it's the initial transition from a lack of vocabulary to a new vocabulary, which is the complex part of Manaka. But the practice is actually quite simple.
Okay, so you have kind of mentioned the four-step method already in some detail, but maybe to help me understand it better, if you have a patient on the treatment table, can you walk me through these four steps?
Yeah. So the first step is palpation, and you palpate the belly, and you look for reactions on the belly that correspond to imbalances in the eight extras. So the most obvious one to think about is the renmai. So if you palpate the midline and you find some tender reactive points, and you palpate some other points that can confirm that diagnosis, then your treatment is going to be treating the master and couple point of the renmai. So that's your step one. And then you can do the same for the chongmai or the daimai or the yangwei mai, etc., the dumai. So there are reactive points on the abdomen, on the torso, that will bring you into that pattern. Once you've done that pattern, so let's stick with renmai. We've done lung 7 and kidney 6. We turn the patient over and we do backshoe points that correspond to lung 7 and kidney 6. So for example, I'll simplify things. We could do bladder 13, which is the backshoe of the lungs, and bladder 23, which is the backshoe of the kidneys. So it's not quite that simple, but I'll just give that as an example. So then we've done step one and step two. Then you can look at the patient's back and say, oh, look, the muscles are really developed in the lower part of the body, the lumbar area, it's really tight. So there's some structural imbalance there corresponding to the kidneys. I'll do some structural adjustments called sotai to adjust that. And this is not a kind of chiropractic kind of adjustment. It's a soft tissue adjustment and very easy to learn and practice. And then patient gets up and says, oh yeah, that's all very well, you're doing all this root treatment, but what about my knee pain? And then Manaka had a system of treating pain, for example. So a way of treating symptoms. So we can do something for knee pain using his isophasal method. So we've got a very logical progression. We palpate the belly. We find something that says, oh, this corresponds to chongmai. This corresponds to the yin shao renmai pair. So that's the midline tightness. Okay, I'll do lung 7 kidney 6. I'll turn them over. I'll do these backshoe points that correspond to that. Bit of structural adjustment, bit of symptom relief, and Bob's your uncle. You finish your treatment. So it's a very logical, systematic progression.
Doing the abdominal diagnosis, if somebody has, like a practitioner, has never done a lot of abdominal palpation, is it something that's easy to learn? Is it very clear, or does it take years, like pulse reading, to kind of figure out what you feel?
I think that's a really good question, and I think it's much simpler to learn than pulse taking. And Manaka actually, he did use the pulse, but he didn't teach the pulse. So his system is designed to be used without pulse taking. And I think it's relatively easy. Of course, it takes a little bit of time to get used to it, but like all things, you practice a little bit and you start to notice, oh yeah, I can feel this tightness here. I can feel this tightness here. And what's nice is that your patients can come feed back to you and say, oh yeah, that feels tight. Oh, that's a bit painful when you press that. I didn't know that was painful. So you can also work collaboratively with your patients to get the feedback that you need to make your pattern choice.
Thanks. I think that gives a pretty clear overview over the four-step method. At least I see that more clearly now. Let's move to your book. I know you've been working on it for a couple of years, I believe, together with Stephen Birch. Can you talk a little bit about the book? When is it coming
Yeah.
out? And what is it? What's new in this book?
Right. So there's the book, Manacle Made Simple. Let me just enlarge it for you. I'll cover my head for a second. There you go. A step-by-step guide to Dr. Manaka's system of Japanese acupuncture and moxibustion, Volume 1. And it's by myself, Stephen Birch, Marion Fixler, Brenda Lowe, and Paul Movsesian. Now, hopefully I can drag that away. Yes, great. When Stephen Birch kind of ghost wrote Chasing the Dragon's Tail for Dr. Manaka, Dr. Manaka made it into a manifesto, if you like. It's a mission statement. It's all about Dr. Manaka's research, his findings, his amazing theories about acupuncture, the experiments that he performed that demonstrated one thing or another. So it's a very rich book. And when I read it, for me, it was like a white knuckle ride. And I was reading it on the bus. I was reading it when I was queuing in the bank. I was reading it in bed. You know, I really couldn't put it down. It was the best acupuncture book I'd ever read. But as a course accompaniment, it's not a good book because you're always kind of leafing through it and finding things here and finding things there and trying to put it together. So over a period of time, Marion and I used to co-teach Manaka a lot. We started off as assistants to Stephen, and then we started teaching it individually. And we started to make a lot of handouts, you know, very practical handouts that would go with each part of the lesson, each lesson within the day. And eventually we got to thinking, well, these handouts would make quite a good book, wouldn't they? And as the way these things go, you know, we planned the book, but it just kind of wasn't quite happening. And eventually I approached Stephen and said, look, Marion and I've got all these handouts and we want to write a book. Would you like to write it as well? Would you like to join in? And Stephen said, yeah, I'd love to. But would you also include Brenda, who teaches Manaka in the US, and Paul, who teaches Manaka in Australia? And that way it will be kind of represented across the continents by people that Stephen really trusted as teachers. So I ghost wrote it, and the idea was it would be a clinical guide, a book that would accompany the workshops that we were running, and this would accompany the lessons that we teach in level 1. And then, as is the way of these things, it grew. And it turns out that there are actually two aspects to the book. One aspect is really simple. It's like explaining Manaka's theory, explaining the 4 steps, and telling you how to do them. This is how to needle. This is how to do moxa. This is how to do sotai. This is how to do each of the steps. This is how to do it. Here's a map of the ear. Here's a map of the hand. So very, very practical. But there are some really interesting essays in there as well. So there's what we call context chapters. And those chapters, one which really talks about the distinguishing features of Japanese acupuncture, the history of it, how it developed, and then the history of palpation and how it developed and how it's relevant to Manaka. And finally, moxibustion, like a kind of history of moxibustion and some discussion of the theories of moxibustion and what it could be doing. So the book is actually quite rich, not just for people who want to study Manaka, but for people who want to learn about Japanese acupuncture generally and to see how it is so different from Chinese acupuncture and how the thinking varies.
But comparing it to Chasing the Dragon's Tail, which I personally found quite challenging to read, this book is an easier read and let's say more practical, or can be put into practice more easily.
Yeah. So as much as possible, I've tried to make it as if, because I did most of the writing and then I kind of adapted people's kind of input. So I've tried to make the author's voice conversational. So it's as if I'm talking to you and explaining things. And sometimes, so it's very conversational. It's not academic. It tries to be readable rather than tries to be academic. And, so it's not lofty prose at all. But I think we're very grounded as well, and we're very well referenced. And so we don't make any statements that kind of aren't referenced, we got this from this book or we got this from this book. So I think it's an academic book in that sense, but it's a very chatty and friendly book in another sense.
Okay, well, excited to read it then. When will it be out exactly?
Our launch date is February the 18th.
February.
So, yeah, February the 18th. So just after Valentine's Day.
Okay, so it's just in time for the course because you will be teaching a Manaka System Acupuncture Level 1 course here at Chiway at the end of February, beginning of
That's
March.
right. Yeah.
What will people learn in that course? Can you tell us a little bit after three
Yes.
days? Can you
Okay.
actually put that into practice?
Yeah. I always recall Stephen's words at the start of my first Manica Level 1 course. And what he said is, we started the course on Friday, so we had Friday, Saturday, Sunday. He said, by Monday, you will be able to practice this system. And sure enough, Monday came, but I actually took Monday off. But on Tuesday, I went into clinic and I did my first Manica treatment on a patient, and I never looked back. I literally turned away from TCM on that day, on that Tuesday, and I I stuck with Manica for a long time, and then I gradually expanded to other things, and then kind of I've more or less gone full circle back to Manica now. But I can make the same promise to people who will go to Manica, is that by the end of the Sunday, you will have everything you need to practice Manica in your clinic the next day. Now, there is a level 2 and there is a level 3, and there's even a Manica Advanced that Stephen runs. And if you think that you're going to learn 8 or 10 songs and a dance routine on level 1, and that's kind of everything that Manica did. But they're also kind of every what we call basic Manica, and you'll be able to perform that right away. But of course, he was an amazing person, an amazing individual, and Chasing the Dragon's Tail is a testament to that. So there's stuff that we can teach you at level 2, which will expand your repertoire at level 1 and expand your repertoire at level 2, and the kind of things you can do for structural adjustments level 3 and step 3 rather, and also the kind of ways that you can treat symptoms at step 4. So basically, at the end of level 1, you will be able to practice this system and get results with your patients.
You said you yourself kind of after learning Manaka Style turned away from TCM and did mainly Manaka Style, but can
Yes.
someone combine it with TCM? Can you do TCM treatments and for certain patients where that doesn't work, do the Manaka Style treatment?
Manaka style treatment is essentially quite gentle. The needle insertion depths are very, very shallow. So you're needling in lung 7, for example, maybe 2 to 3 millimeters. And so much so that the needle will fall over under its own weight. And the same with kidney 6, the same with pericardium 6 and spleen 4 and the other points. So it's very superficial and it's very gentle. So when you do, if I was to needle lung 7 and try and get de qi, it would not have the same effect as this kind of very subtle needling. And there are kind of other aspects to Manica where I would say that, and there's a very long chapter in the book all about dosage. So all of the techniques within Manica steps 1, 2, 3, and 4 are kind of tailored to fit with each other, because there's this concern about dosage that you don't want to overtreat the patient. So I would say that if a patient came in and I thought to myself, wow, this is so obviously, I'm going to needle heart 6 and kidney 7 because they've got night sweats, and I'm going to do spleen 6 and Ren 4 maybe, and bladder 23. So from a TCM point of view, I just know what I'm doing, then do that. But if the patient comes in and you're scratching your head going, oh, I don't know what to do, then that's when you would do Manica, and just keep it separate. So do Manica 1 week and TCM another week if you like, but don't try and combine them into the same session.
Okay, but alternating the treatments, that's possible.
Yeah, that, for sure.
Um, if I'm interested in joining this course without any prior experience in Japanese acupuncture, is that possible?
I think that's great. Um, you really don't have to have some kind of background in any of the techniques because we will teach you. It's a very practical course. So we'll teach you palpation, we'll teach you rice grain moxa, we'll teach you how to do moxa on the end of the needle, Japanese style. We'll teach you shallow Japanese needling. So, and we'll teach you sotai. So you don't need to know these things before you come. We're going to teach you.
Great. Oren, thank you very much for talking about your new book, talking about Manaka Style Acupuncture and about the course. I'm looking forward to welcoming you at the end of February in Winterthur.
Very much look forward to that. And I hope it won't be too cold.
Maybe there's going to be a little snow here.
Right.